Welcome to the Deep Dive. Today we're jumping into cholinergic agents. These are drugs that basically tap into acetylcholine, a super important messenger in your body.
That's right. And our mission really is to get a handle on how they work, what they're used for.
And yeah, what happens when things go a bit wrong.
Exactly. Think of it like we're trying to fine-tune this vital communication system. Some agents directly mimic acetylcholine, others kind of boost the natural supply.
Okay, so let's break that down. Two main groups, you said.
Yep. Direct acting and indirect acting.
The direct ones. They're like the stand-ins for acetylcholine itself.
Precisely. You've got choline esters, acetylcholine, botanical, carbachol, and then alkaloids like pilocarpine and muscarine. They bind right to the receptors.
Gotcha. And the indirect ones, anticholinesterase, you call them.
Mm-hmm. These are clever. They don't actually touch the receptors. Instead, they block an enzyme, acetylcholinesterase, or ACE.
Ah, the enzyme that cleans up acetylcholine after it's done its job.
You got it. So, by blocking ACE, more acetylcholine sticks around in the gap, making its effect stronger and lasts longer.
And there are different types of these blockers, too.
Yeah, reversible ones, think neostigmine, physostigmine, edrophonium. They block it temporarily.
Okay.
And then the irreversible ones, these are the heavy hitters, often organophosphates like parathion, malathion. They basically shut the enzyme down for good.
Wow. Okay. So to really get this, we need to talk about where acetylcholine actually acts, the receptors.
Key point, two main families. Muscarinic, M1, M2, M3, found in places like your heart, smooth muscles, glands.
And nicotinic.
Nicotinic, right. Yeah. You find those in autonomic ganglia, like relay stations, and importantly, at the neuromuscular junction, where nerves talk to muscles.
And the effects can be really specific, can't they? Like what? Hitting M2 in the heart slows it down.
Exactly. It opens potassium channels, causes hyperpolarization, slows the heart rate, but hit M3 in blood vessels.
And it does something different.
Totally different. It makes the vessels release nitric oxide, causing them to relax, widen.
Which drops blood pressure. Interesting. Different keys for different locks.
That's a great way to put it. And that specificity is useful. Like bothanicol, it mainly hits M3, so we use it for urinary retention, or when the gut's sluggish after surgery, helps get things moving.
And pilocarpine, another direct one.
Also direct. Good for glaucoma. Helps with dry mouth, too. But because it can hit other muscarinic spots, you might get side effect sweating, maybe some bronchospasm, slower heart rate.
Right. Okay, let's swing back to those indirect agents, the anticholinesterases, blocking the enzyme.
So neostigmine and its group, the reversible ones, they just get in the enzyme's way for a bit.
But the organophosphates, permanently disabling it, you can see how acetylcholine levels would just skyrocket.
Absolutely, leading to overstimulation. That's the danger.
But also the therapeutic potential, right? You mentioned uses.
For sure. Pilocarpine for glaucoma, as we said. Neostigmine and pyridostigmine are lifesavers for myasthenia gravis.
Ah, myasthenia gravis. That's where the immune system attacks the nicotinic receptors at the neuromuscular junction.
That's the one. Autoantibodies destroy those receptors. So boosting acetylcholine with these drugs helps the signal get through.
Makes sense. How do they even diagnose that?
Often with the edrophonium test. Edrophonium is a very short-acting anticholinesterase. Give a small dose.
And if muscle strength improves quickly, even for a moment.
It strongly suggests myasthenia gravis, yeah. Because that little extra acetylcholine makes a difference. It can also help figure out if someone's having a myasthenic crisis versus a cholinergic crisis.
Okay. And then the really dangerous side, organophosphate poisoning. From pesticides, usually.
Often, yes. It's a massive overload of acetylcholine everywhere.
What does that look like?
It's a storm. Muscarinic effects. Drooling, sweating, wheezing, pinpoint pupils. Nicotinic effects. Muscle twitching, then weakness. Even paralysis. And CNS effects in the brain. Confusion, seizures, coma. It's bad.
Sounds terrifying. How do you treat it?
It's an emergency. First, decontamination, get the poison off. Then atropine, lots of it. It blocks the muscarinic effects.
Okay, it blocks the receptors.
Right. And then, crucially, pralidoxim, or 2PM. This can actually reactivate the ACE enzyme, pull the organophosphate off, but you need to give it early.
Before the bond becomes permanent.
Exactly. And of course, supportive care especially help with breathing.
So clearly powerful drugs. What about general side effects, even with therapeutic use?
Well, the main risk is pushing things too far, a cholinergic crisis. Too much activity. Think diarrhea, sweating, urination, muscle weakness, bronchospasm. The opposite of what atropine fixes.
The SLUDG acronym sometimes. Salivation, lacrimation.
Urination, defecation, GI distress, emesis, yeah, that covers the muscarinic overload well. And specific drugs have quirks. Pilocarpine can irritate the eyes. Neostigmine might cause gut cramps.
Okay, so wrapping this up, we've seen two main strategies. Directly hit the receptors or indirectly boost acetylcholine by blocking its breakdown enzyme.
And it's this incredible balance, isn't it? We can use these agents to treat conditions like glaucoma or myasthenia gravis, but tip too far, especially with things like organophosphates, and you get severe toxicity.
A really fine line. It highlights just how critical acetylcholine is.
Absolutely.
So here's something for you to think about. Acetylcholine is involved in so much: muscles, glands, heart rate, even memory and learning. What other conditions, maybe ones we don't typically link to it, might actually have a hidden cholinergic component we're just starting to understand? Something to ponder. Join us next time for another deep dive.